So today I want to talk about what is low cortisol. So you will hear people with Addison's disease talk about low cortisol all the time. And so I just want to specify what that is so people can have a better understanding and know what that terminology means or what it looks like and what's happening inside that person's body. So I wanted to do this video now because I'm not like really low cortisol, but definitely on the lower end of things. So it's maybe not the best time to do it for my brain, but a good time because it's kind of happening in my body right now. So again, with Addison's disease, it's an adrenal disease where your adrenal glands are no longer producing the necessary amount of hormones that your body needs to function. So your body has a hard time doing anything without those hormones. So cortisol is one of those hormones. You need it to live, to do things. And as an Addison's disease patient, I take cortisol replacement through steroids. And I take those pills every 5 hours, different for every person, an amount. But when your body runs out of that pill, you're going into low cortisol. You're running low on the amount of cortisol that's in your body, and different side effects start to take place. So low cortisol means when there's little to no, almost no cortisol left in your body. And you have to respond by taking more medicine, or if you're so low that you're going into a crisis, then you have to do the emergency injection and go to the hospital. But low cortisol symptoms are totally different for every person. But mostly the things you'll hear are brain fog is number one, because your body decides in that moment. It kind of prioritizes where to send the cortisol. So your body will sit there and go, should I allow the brain to function or the heart to pump? And so the cortisol shifts to certain places, which is why, okay, maybe I won't be able to think as clearly or communicate or even know really what's going on. So brain fog is one. For me personally, my body starts to wind down. I kind of like the visual of unplugging a computer. And those old school computers would be like, ooh. That's kind of what my body feels like in low cortisol. My shoulders hunch in, I get really heavy, my eyes get really heavy, and it's harder for me to breathe. If I'm really low cortisol, I personally get a lot of joint pain. And so much joint pain that sometimes I'm not really able to walk, and I have a really cool cane that also has a chair that I use if I need help walking. Or I get kind of stuck and I can't really move my body at all. And then I lay around. Those are all my personal low cortisol symptoms. Oh, and patience is non-existence. No patience. There's just no ability to process patience. Cortisol is the stress hormone, the fight or flight. It allows you to process a stressful situation. So if you have so little cortisol that your body is not able to help your brain function or allow your body to walk, then of course processing a stressful situation is not gonna happen. It just can't. So definitely loss of patience is another low cortisol symptom. Those are pretty much all of mine. Again, it's different for every single person, and for me, if I take my pills in about 20 minutes, the effects are gone, and I can go from being lounging and unable to move on the couch to literally going through a yoga flow or jumping on the trampoline or going for a hike 30 minutes later. It's just dependent on how quick the pills set in or if my body receives it in a thorough way. Those are my low cortisol symptoms, and that's what low cortisol means when people with Addison's disease are saying that. And now you know.